Hi Ted, I have been meaning to ask you how you are doing with your recent diagnosis of type 2 diabetes. Have you been to the doctor lately?
Thanks for your concern, Sheila. I am feeling much better now that my blood sugars are better controlled. I recently saw my internist who suggested I consult with a podiatrist.
Why a podiatrist?
You may not realize this, Sheila, but diabetics are at great risk for foot problems. This is worsened if our blood sugars are not properly controlled.
So what did the podiatrist tell you?
He performed a complete examination of my feet. In the examination he observed the way I walk. Additionally, he checked the circulation in my feet as well as checking the nerve sensations going into my feet. He also took a look at my skin and nails. After the examination he sat and talked with me about how diabetes may adversely affect the feet.
So, what did you learn?
When my blood sugars are excessively high, two bad things happen in my feet. Over time, the circulation into my feet becomes less and less. This is because elevated blood sugars affect the arteries coming into my feet and basically cause them to clog up. Elevated blood sugars also cause the nerves running into my feet to no longer properly conduct nerve sensation and use of the muscles in my feet.
What can happen when this occurs?
As the doctor explained to me, in a worst-case scenario, if I have poor blood circulation and poor nerve sensation in my feet, I might step on something like a piece of broken glass and not even know it.
What would happen to your foot?
Since I cannot feel the bottom of my foot, the broken piece of glass would probably become infected. But the problem here is that without adequate circulation the wound would not heal as blood brings nutrients to the area. Antibiotics are also less effective because they too require blood flow to get them to the wound.
Wow, that sounds serious.
Yes, it is. That is why there are so many foot and leg amputations in this country. As the population becomes more obese, more people develop type 2 diabetes, so the rate of diabetics in this country is actually increasing.
Well, Ted, what did the doctor suggest you do to avoid this type of diabetic complication?
The most important thing I can do is maintain proper blood sugars. Even though I may feel fine, every day that my sugars are elevated, the disease is doing damage not only to my feet, but my kidneys, heart and eyes as well. The podiatrist also suggested that I examine my feet daily, looking for anything that may appear out of the normal and immediately bring it to his attention. Proper foot hygiene is also very important. This includes washing and drying the feet every day. Since many diabetics experience very dry skin, the use of lotion daily is also very important to avoid the skin from cracking and becoming infected.
How about the shoes that you wear?
Good point, Sheila. The doctor told me to avoid shoes that are too tight as pressure points may develop, and because my sensation may be diminished, I might not even notice it and could develop a blister or even a callus that could break open and also become infected.
That makes a lot of sense.
It does. Plus the doctor also suggested wearing an arch support in my shoes even though I do not have foot pain. The purpose of the arch support, or orthotic, is to more evenly distribute the pressure along the bottom of my feet and thus reduce pressure points. Excessive pressure points can eventually break down and form diabetic ulcers, which the doctor explained to me can take a very long time to heal, if at all, in the diabetic population.
So does the podiatrist want to see you again?
Yes, obviously if a problem develops I am instructed to come in immediately, but assuming I am doing well, he suggested yearly exams where he will perform a comprehensive diabetic foot exam. In that exam he will measure the circulation going into my feet as well as assess the neurological status of my feet. If he finds any abnormality in the test compared to the previous year's test, it will alert him to the increased risks of foot infection and will take appropriate actions.
Sounds like you are in good hands, Ted. If you do what the podiatrist says, chances are you will avoid any major foot problems.
I agree, Sheila. Thanks for your concern.